welcome to Back to Health. My name is Dr. Philip Corbin. I'm a chiropractor here in Bella Vista. I am a American College of Sports Medicine certified health fitness instructor and cardiac rehab specialist, and I'm an exercise physiology degree from the University of Arkansas. Today we're going to talk about a couple of conditions that affect primarily the teenage group, and I have a couple of guests to talk with about that more specifically. We'll be talking about spondylolisthesis and chondromalacia patella. Okay, so first of all, we're going to talk a little bit about spondylolisthesis. Spondylolisthesis, if you take the root definition of the word, spondylo refers to the spine itself, and listhesis would mean moving. Okay, so it is where one vertebrae actually slips forward in relationship to the one below it. Typically, the symptoms are wide-ranging in what would experience. It can be anywhere from mild to severe to absolutely no symptoms whatsoever. Low back pain, muscle tightness, pain in the thighs or the buttocks, stiffness, local tenderness to the area that it's involved, and in more severe cases can be nerve damage, okay, due to the location of what's going on. Spondylolisthesis is caused by two primary factors. You can have a congenital defect, a birth defect. It could be something like spina bifida or hemivertebrae, where the bones in the back themselves actually don't form correctly, and then it makes the spine adapt in an aspect where it creates a greater stress upon the posterior components of the spine, and I'll show you a little picture here in just a second. Fracture is the more common scenario, specifically in the young teen girls, particularly gymnasts, people that do a lot of impact things, and when they're going through those growth periods, a lot of times can have a fracture that occurs in the back, and it actually creates this listhesis. Or you can have degenerative disease. This can happen in adults. Arthritic changes, degenerative joint, degenerative disc disease, you can have creating this spondylolisthesis. The problem lies in that you have the vertebrae in the low back, and say this is the tailbone, this is the fifth, fourth, and third vertebrae in the low back. The vertebrae here will move forward in relationship to the one below it, and where the spinal cord comes down through this aspect of it, if this displacement is severe enough, it can create quite a bit of stress upon the nerves that exit this and supply specifically the lower limbs in the low back disorder. And the most common scenario is for to be between the sacrum and the fifth lumbar vertebrae. Second most common, particularly in the adult situation, would be between the fourth and the fifth vertebrae. How would this be tested and or diagnosed? Well, the gold standard for testing would be to, somebody comes in and they have low back pain, or my back hurts when I bend backwards, will be something that we'll hear about, or I get pain in my buttocks, and so after doing a thorough exam, making sure the orthopedic and neurological signs are all the way they're supposed to be, you take an X-ray, and you do some measuring and drawing lines on the X-ray, and actually are able to determine the degree of listhesis, and that gives you a grade, and the grade then determines what sort of treatment protocols are most acceptable. When the grade is on the lower half of the scale, most of the treatment protocol will be very very broad, whereas if it becomes more severe, it absolutely can become a surgical intervention. Treatment obviously varies with the severity. From extreme to severe, it is a surgical procedure. You could have neurological compromise, loss of bowel and bladder function are common scenarios. So in those situations, it is absolutely a surgical procedure. Most of the times, though, particularly because it predominantly affects the younger age group, things like physical therapy, chiropractic care, being able to make what is there utilize itself most functionally will keep this from becoming a degenerative disorder or something that will be limiting in any way. Most people that have a spondylolisthesis experience very, very limited issue of functionality, but it is always there and will be through their lifespan, and it is something that needs to be treated. Drug intervention specific to the symptomatology of pain and swelling and those types of things would be muscle relaxants, anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, and even some pain modification things such as oxycodone, things like that on certain extreme conditions. So in the situation with the spondylolisthesis, we talk about the most common scenario being fracture. Well, if imagine a young lady is doing a backwards tumble, flip, and lands and falls down, creates a great force up through the spine, and where the vertebrae come together, it will fracture the area right through here, which is called the pars, and this area will fracture and create this part slipping forward on that. The other scenario would be on a dramatic trauma. You would have it actually just riding up and over and not actually breaking any bones whatsoever. And that situation becomes very stressful from a pain standpoint because the soft tissue is so overexerted in that type of a scenario. The other thing we'd like to talk about today is chondromalacia patella, and that chondromalacia literally means softening of the articular cartilage, and the patella refers to the kneecap. Okay, so it literally means softening of the articular cartilage of the kneecap. People that have this will talk about having pain on the front of the knee, around the outside of the knee,